Hair loss at the age of 21. Do I have enough donor hair for a transplant? Taking finasteride has lowered hair loss. Now considering hair transplant as the density has reduced a lot, and I was wondering whether I have enough donor hair.
Thank you for your question. You're 21 years old, you're taking finasteride, you've noticed an improvement in your progression of your hair loss. Now you're asking if you have enough hair for a transplant in terms of the density, and you've submitted a couple of good photos that where your hair is cut short, so certainly we could see a lot. Well, I'll tell you how we approach a situation like yours in our practice. And before doing that, I'll also share with you the general philosophy that has been consistent for many years until recently in hair transplant surgery. And this philosophy was always to avoid transplanting patients in their 20s. And why is that? Well, you are someone who is almost exceptional because you're taking finasteride and you've responded well to it. When someone is in their 20s and losing hair, if you think about the transplant procedure, you'll understand that if your hair continues to progressively go away, then you can't transplant enough to keep up with the requirements of the space that needs to be filled. And eventually you run out. Now recently I've noticed a lot more transplant surgeons are operating on men in their 20s, and we're also seeing people who are in their 30s who had several transplants by the time they were in their early 30s, and unfortunately they continued to progress, and so they ran out of transplant donor area. Because understand, the space that you need to fill is never, it's too much for the area where the grafts are taken from. This limited band is a finite area. So my recommendation to you is to not do a transplant. Now there is an option that has worked in our practice very well that may be appropriate for you, and I'm just describing what the scenario would be if you were to come to us as a patient. When someone your age who is taking finasteride is responding well, we would look under the microscope and we would look to examine to see if there is any evidence of any miniaturization or still hair that is very thin. And there are patients who we've actually done a treatment called hair regeneration. Hair regeneration is effectively a reversal of hair thinning for existing hairs. It doesn't bring back hair where hair has been gone for, let's say, over 5 years, but hair that is thinning actually becomes thicker. This is a new method that we've developed over several years, and it combines a wound healing material called extracellular matrix and platelet-rich plasma, which is derived from your own blood. At this point, for all intents and purposes, it's a one-time injection, with the exception that some people who are more advanced may get a second injection. But basically, over the course of 12 to 18 months, we follow the patients every 3 months from point 0 to 3, 6, 9, all the way to 18 months, and we watch your hair improve. Now, what is clear advantage is that there's no surgery. And what we have seen over time is that in the right candidates, hair regeneration will actually exceed the volume correction and improvement that would take easily 2 hair transplants. So in someone like yourself, you have to also be mindful that although you may be okay with the finasteride now, let's say 6 months from now or a year from now, you start having side effects. Then you'll have to stop. And then what will happen? You'll continue to progress. So I would certainly dissuade you from doing any kind of transplantation and wait it out. If you are interested in improving density, then what we would do in our practice is discuss with you the risks and benefits of hair regeneration. But certainly I would, again, because you're in a very good place, but we cannot be certain that you are going to be able to take the finasteride long term, I would avoid doing a transplantation, if at all, until you're much older. And you can certainly learn about the technology we've developed called hair regeneration. So I hope that was helpful. I wish you the best of luck, and thank you for your question.